Teresa Freed with Johnson County Government. It's our goal to stop the spread of COVID-19 in our community. We also want to make sure you have the latest information on our efforts. For data on how COVID-19 is impacting the county, visit our dashboard on jocogov.org.
We released the new dashboard. Essentially contains the same information, but presented in different ways. And it would take a while to make an adjustment to that. And a lot of the changes we made were based on feedback that we received. The big change is in this section on schools. And I want to spend some time talking about that. We have been dealing with this virus now for 7 months, and we're learning as we go. It's a pandemic unlike any that we have seen. It's a new virus. We're learning new things about the virus every day. We're also learning new things about our response and how to best mitigate the impact of the virus. Earlier, we had the shelter in place, but we took away the shelter in place and then we modified our approach that allowed businesses to open in a way that is safe. We asked them to wear masks, we asked them to physical distance, we asked them to encourage their employees to stay home when they are sick. And by and large, that has worked across the country. And we have been pretty consistent with our messaging that masks do work, and it's by far the best tool that is available to us. And so our approach to businesses is not any different from what we are trying to do with our schools. Again, these are really uncharted territories for all of us. We have been working with school districts since early on in the response to the pandemic. And we have spent time with the superintendents and school nurses so that we can understand the processes and look for opportunities to reduce the risk that is associated with opening schools. What we have made very clear is, while we are very, very impressed with what our school districts have done in terms of mitigating the risk, they have worked on improving ventilation. They have worked on physical distancing. There is the mask mandate that requires students to wear masks and staff and administrators to wear masks. There is the screening for symptoms that will be ongoing. There's also the continuing collaboration with us. When we see cases, we put them in isolation and their contacts in quarantine. All of those are steps that we take to prevent the spread of the virus when when we find positive cases in either teachers, students, staff, or administrators. In the continuum of virtual learning, hybrid, and in person, we recognize that the risk increases. It's higher for hybrid than it is for virtual learning, and it is highest for in-person learning. But we have also been very clear that our consideration here is not just health, it is taking into consideration the advantages to physical, mental, emotional health of in-person learning, especially for a younger age group where experts have made it clear of the negative consequences of not being able to do that. And so we take this into consideration. We also take into consideration the processes. For example, elementary school, we're able to cohort them better and keep them in the same group. And so in the three things that we're looking at, first of all, do our best to prevent introduction of infection into school buildings. Two, when we find these infections, do our best to minimize the spread within the cohort. And three, if we do find outbreaks or cases, make sure that it's not building wide. Those are the three things that we are trying to do. And a lot of our efforts are geared towards that. And so in the schools, the ones that have opened elementary school, the ones that have done hybrid, as we thought would happen with elementary school students because of the ability to cohort, because their processes and habits are different from the older students. After a few weeks, seems to have worked. And I do also want to mention that we did keep our daycares open throughout the summer using the same concept. and those seems to have worked. We have not had major outbreaks in there. Now, as school districts are getting into opening up secondary schools for in-person or hybrid learning, those are different types of challenges. And we have made those clear again that in-person presents the highest risk. However, we also have those risk mitigation steps similar to what we have done elsewhere in the county for businesses, for different types of businesses really, is that if we get a majority of the staff, students, and administrators to wear masks, if they do physical distancing, if they avoid house parties and avoid bars, those could work. Now, does in-person now mean in-person in 2018 like we did in 2018 and 2019? No. Physical distancing has to be there, and it's got to be gradual, which was one of the points that we emphasized. And if the efforts to contain this doesn't work, then we still have our public health tools of isolation and quarantine to ensure that we prevent the spread. Now, I would say that a lot of these secondary school students have been playing sports and being part of other extracurricular activities. And when we have found cases, we have isolated and quarantined as necessary to prevent widespread infection. And I will say that the cooperation that we have received has been pretty vital to our ability to contain the spread of the virus. And lastly, on our dashboard, I want to be clear that our key metric, our key measure for determining where we are is the incidence rate. Okay, we've had a lot of questions about positivity rate the past three months really, and as you will see, there are multiple ways that it's been calculated. KDHE, the state calculates in different ways. We were calculating a different way, and then we introduced another way which is closer to how KDHE does that. The overall goal is to present to you the different ways of calculating that. However, if you look at our incidence rate, right now we're in yellow, but we're kind of straddling pretty close to the red line. We're still averaging daily numbers that range from about 90 cases a day to about 115 cases a day. We need to continue to work together as a community to bring that down. That is the key metric that schools should look at. We do have those two and a link to the KDHE way of calculating positivity. If you look at those three, you will see that the trend is very similar. The numbers might be different. So what you really need to do is look at the trend. If where we are now, for example, with incidence rate, we're on the upper end of the orange zone, and positivity rate seems to be trending down. That's a good thing. So if our incidence rate is trending down and positivity rate is trending down, as long as we keep doing what we are doing, that's good. Now, if incidence rate is trending up and positivity rate is trending up, that should signal something to us that we have a lot of work to do. Again, for the school districts, for parents that are out there, the key metric to look at is the incidence rate. In our field, we look at data in so many different ways. Some we present to you on the dashboard, some we're not. But every little bit contributes a little bit to our knowledge. So it's not really, we don't have the luxury of looking at a single data in a single way to make all of the decisions that we need to make. Again, re-emphasizing that our key measure is the incidence rate. But positivity rate does give us information. If it's trending up, it could be an indication that infection is about to spike. And so we need to be able to know that. The other things that I want to emphasize in the gating criteria are what we call the modifying variables. Okay, if we're in orange and you are conducting sports, athletics, and other extracurricular activity, just understand that it's an added measure of risk, and it means that you have to take extra precautions to make sure that things do not escalate in terms of infections. And then we have other risk mitigation steps that schools have been doing this for a while. If they can ensure physical distancing, if they can ensure that they have the capacity to follow up on the cases and people that they have close contact with, if they can ensure that they have the capacity to work with us. And by the way, because we're having quite a few cases in the country, we are also looking at our capacity to respond to this. And so all of those things are important consideration for the school districts to make their determination. We have been very clear from the start that what we are providing are guidelines to the school districts, and the school districts, along with their parents and students, make the decisions that's best for them. We also know that our country is pretty diverse, and that different districts will make different decisions, at which point our role is to continue to work with them to ensure that we protect our students, protect our teachers, the staff, and the administrators.
For more information about COVID-19 in Johnson County, visit jocogov.org/coronavirus. You can also subscribe to a daily e-newsletter with the latest data and precautions being taken in the county and state.